Hello, my name is Carl Eschbach. I have written copies of my remarks to give you. I'm certainly not going to go through all of these. I live at 2416 Avenue L in Galveston. I'm by education and training a sociologist and demographer, and have been a professor at the University of Houston, the University of Texas at San Antonio, and I'm currently a professor at UTMB, where I'm also a research fellow with the Center to Eliminate Health Disparities. The opinions, however, that I'm expressing today are my own. I guess I'm not going to go through all these remarks. I appreciate the correct description that tax credits are what economists call a tax expenditure, a subsidy where taxes are forgone to get people to do something. It's an $8 billion program. It's one of HUD's, or one of the federal programs to address needs in housing markets. The biggest tax expenditure giveaway subsidy is the deductibility of mortgage interest. That's an $89 billion expenditure targeted on the well-to-do. Actually, the total tax subsidies to homeowners is $150 billion. That's about 3 times the total HUD budget. So actually, I'd like to, if people are concerned about the size of the deficit, people are concerned about the government interfering in the market, you can do something right now without asking City Council to do it for you. When you're filling out your tax form, if you're a mortgage holder, you're filling out a tax form this year, don't claim the mortgage interest deduction. Don't claim other tax subsidies, and stand up for your convictions. Well, obviously, nobody would do that. Obviously, nobody would do that. But I guess my point here is, so I wouldn't recommend that you do it, actually, until we reform our tax code. I'm not a big government guy. I could have liked to maybe, I don't think that tax subsidy is actually well directed. I think it's mistargeted on the rich and hurts the poor, actually, by diverting resources, economic resources, to the upper end of the market rather than the lower end of the market. But I don't think, until we reform the tax code, that you should forgo your claim. On the other hand, then, if I were to tell talking to a low-income person, I would probably not recommend to them that they forgo the opportunity to live in tax credit housing, right? But unfortunately, it's not their choice. First, developers, city, state, have to act. And if they don't, essentially, we're in a situation where, under our current system, a large fraction of the money spent on to be devoted to low-income housing comes through this program, and it doesn't seem to me to be appropriate to make the decision not to not allow people to take advantage of that program. Thank you.
Thank you. Thank you very much, sir. Lexi Nolan, followed by John Prohaska.
Good. I was going to say afternoon, but it's becoming evening, isn't it, Mr. Mayor, Mayor Pro Tem, Council? I'm Lexi Nolan. I reside at 1421 Harborview Drive. I'm the director of the Center to Eliminate Health Disparities at UTMB. My comments today only reflect our centers and not UTMB's necessarily, and are in relation to Resolution 11D. Through the Galveston Health and All Policies Project, the Center to Eliminate Health Disparities has been supporting city departments and local community agencies, as well as the City Council, for the past 3 years to rebuild Galveston in ways that improve the health of the population and reduce inequalities in health between the best off and the worst off in our community. Ours is a broad view of health, encompassing not only health care, but also issues related to the built-in social environments, as well as policy influences on health. At the request of the city, we have conducted community forums, provided a health impact assessment of the city's draft comprehensive plan, contributed to the development of various master plans, and provided research on other issues relevant to local policy making. We have highlighted why some initiatives of the past had failed to create healthy neighborhoods and presented solutions. Our center has been happy to respond to every research request, including those of Mr. Greenberg, and seen their value reflected in Council's discussion of issues as well as in local planning decisions. The proposal to suspend all low-income housing tax credits for 3 years is an issue that deserves research and careful reflection with potentially significant impacts, especially for the health of existing Galveston residents, including our more than 5,500 current households in Galveston that pay over 30% of their income on rent. This is called rent overburdened households, as well as for our thousands of daytime residents who cross the causeway each evening because they cannot afford to live on the island. The potential for the resolution to hinder local economic development is important in its own right, and also has an impact on health. Although we clearly can't go into details in such a short form, the breadth of potential impacts of this resolution, given the breadth of potential impacts, we would like to at least mention some important points we believe deserve further consideration. And I have written remarks
Doug.
that reflect my comments. Thank you. Sorry. First, to be very clear, low income is not public housing. It's a notch above public housing and below middle class housing. It's workforce housing. While the use of Section 8 or housing choice vouchers can create difficult conditions for supporting healthy neighborhoods, our understanding is that no new vouchers will be issued beyond those within the returning 569. Therefore, the information presented by our center today does not refer to situations where LIHTCs are used in combination with housing choice vouchers. So, who does live in low-income housing? Quoting the Texas Department of Housing and Community Development, typically, tenants include school teachers, police officers, firefighters, mechanics, single parents who are balancing career and family while attending night school, city employees, sales clerks, and retirees. Affordable housing and low-income units are quite different from public housing units, end quote. May I finish one?
Yes, ma'am. You may finish your thought.
Common tenants also include students. An analysis of UTMB growth anticipates adding over 20,000 new students to the market. And I will add, these numbers have been verified by A&M officials since the publication of the article in the Galveston Daily News. UTMB is also encouraging local initiatives for low-income housing as a strategy for recruiting and retaining their workforce. And this list is precisely the people residents would like to see living in Galveston. Thank you, and my colleague will finish the comments.
Thank you. Okay, so John Prohaska, followed by, I don't know what that is. That's the third time that's happened. Oh, okay. Oh. John Prohaska, followed by Rob Bushman. Okay, yeah, whichever order. That's fine.
Thank you, Mayor.
Yes,
Council.
of course.
My name is Rob Bushman. I live here in Galveston at 70 Colony Park Circle. I'm a research fellow with the Center to Eliminate Health Disparities at the University of Texas Medical Branch, but I'm speaking here on my own behalf and not on behalf of UTMB. I want to continue Lexi's comments. Workforce housing has consistently been a cry in Galveston for many years. State and national data indicates that although there are many open units, as a whole, there's a continuing need for affordable housing by current residents of Galveston that's not met by the current housing stock. The deficit is around 5,500 households, and even if the current vacant affordable housing stock was completely depleted by rent overburdened families, with the low-income housing initiatives in the pipeline, the deficit would still be greater than 4,500 units of low-income housing, and this excludes the needs of those who work on island but live off. As a matter of record, the low-income tax credit housing associated with the plan to rebuild public housing would add just 120 units in total to the 1,079 existing and planned low-income housing units on the island, which is an 11% increase. I'd also like to talk a little more about low-income tax credits. They've become a critical tool for developing workforce housing across the United States because low-income housing often either hasn't been created through the market or it's substandard. These tax credits often bring additional amenities, and in one study, developers reported that without LIHTCs, there simply would not be enough sources of funds to develop initiatives with high-quality amenities that promote safety, comfort, and opportunities for learning or betterment. There are many additional health benefits of adequate affordable housing, including benefits related to LIHTCs cited in the research literature. These include reduced infectious diseases and chronic diseases, reduced injuries and violence, improved mental health, reduced asthma and lead poisoning, two critical health issues in Galveston, reduced homelessness and housing instability, keep in mind the large homeless population in Galveston, including GISD students, safer neighborhoods, including reduced injuries, violence, stress, and anxiety, increased physical activity, and improved school performance among household children. In sum, when communities do not have sufficient affordable housing to meet need, health suffers. But the benefits go further and really affect the entire community because low-income housing in particular can function as a poverty reduction strategy. How does it do this? Rental price ranges function like the rungs on a ladder, creating a continuum of affordable housing. Ensuring that low-income housing is available as one of those rungs can support momentum out of poverty for poor families and can slow and stabilize downward trajectories into poverty for at-risk families. First, low-income housing helps transition poor families trying to get out of poverty. When public housing families begin working and have a chance to increase their incomes, they need a level of affordable housing above public housing but below market rate housing. The 560, do you mind if I...
You can finish your thought, yes, sir.
Thank you. The 569 returning public housing families who will be supported with job training and new employment initiatives, affordable daycare, and other supports will use the LIHTC units to grab on and move up and out of poverty. Thank you.
Thank you, sir. John Prohaska, followed by Lauren Hall.
Thank you, Mayor and Council. My name is Dr. John Prohaska. I'm a program manager at the UTMB Center to Eliminate Health Disparities. I'm also a very proud citizen of Galveston and live at 8017 Gentleview Drive. I'd like to note that today I am speaking on behalf of myself and not of UTMB. Regarding these low-income housing tax credits, some studies have demonstrated that using LIHTCs to build housing can reduce costs to local government and social services agencies as well. One study in Lee County, Florida, estimated cost savings to the community in transportation, health care, and education of over $8.6 million due to the provision of affordable housing. LIHTC-supported development can make critical differences in rebuilding neighborhoods like Cedar Terrace, where previously high poverty rates existed and still do today, and they are areas challenged in terms of recovering in a way that makes a positive contribution to the city. To succeed, these neighborhoods require an explicit effort, such as a comprehensive mixed-income approach, and especially one that incorporates services to strengthen human capital, while concurrently providing quality, affordable housing. This is, in fact, directly in line with the city's newly adopted comp plan, item Land Use 2.7, encouraged the creation of a new urban neighborhood in North Broadway. It is important to clarify that low-income housing tax credits are generally considered an economic development tool. LIHTCs can strengthen the local economy, attract workers, and add jobs as well. This is also recognized in the city's comprehensive plan as part of an economic development strategy, ED 1.5. Turning to the evidence that we found in the literature, one study shows that for every $1 in rental income, over $2 in economic activity in the local economy is generated. Another study showed that each $1 of LIHTC awarded generates about approximately $9.60 in the local economy. Finally, each job supported or created through affordable housing projects generates at least one more job at the local level. We also need to recognize that if Galveston commits to refusing such development, these economic development benefits will likely flow to other nearby communities where they're already in use. Finally, not being able to access LIHTCs may create missed opportunities for the city of Galveston to expand population growth. The Texas Department of Community Affairs says tenants most likely living in these types of households are working Texans or retirees seeking a place that is affordable to live. Retirees generally have regular, though often not large incomes, don't need jobs usually, and do need services. But developing the city as a retirement...
Finish your thought.
As a retirement community would be much more likely to be successful and accelerated if LIHTCs were made available. This resolution potentially could create barriers to Galveston's continued development and economic recovery, and there is great uncertainty as to where the next 3 years, what the next 3 years will likely bring in terms of economy and population growth. Thank you.
Thank you, Doctor. Okay, Lauren Hall, followed by Rosalind Jackson.